Spondylitis in neck and shoulder, causes and treatment. Ankylosing spondylitis, also called axial spondyloarthritis, can cause stiffness in the neck and shoulders. Neck and shoulder pain might get worse after lying or sitting for a time, causing difficulty when a person begins moving again. Ankylosing spondylitis, a form of arthritis, causes inflammation, leading to calcium buildup around the spine. This buildup contributes to the growth of extra bone in the neck and back, causing stiffness and pain. The bones may fuse together due to excess calcium. This video explains how ankylosing spondylitis develops in the neck and shoulders and describes the treatment options. What are the symptoms of ankylosing spondylitis in the neck and shoulders? Symptoms of ankylosing spondylitis in the neck and shoulders can include pain, stiffness, inflammation. These symptoms may worsen after a period of rest, with pain becoming more severe after sleeping or sitting still for a prolonged period and possibly causing a person to wake during the night. Cause difficulty carrying out certain motions in daily life, such as turning the head while driving. Occur in episodes or become constant. Not everyone with ankylosing spondylitis experiences neck pain. Pain and stiffness most often develop in the lower back and hip. Neck symptoms. A 2022 study of Japanese participants with ankylosing spondylitis found that around 10% had pain that started in the neck, while others found that the pain reached the neck as the condition got worse. Shoulder symptoms. As usually only develops in a single shoulder or is more severe in one shoulder than the other. According to a 2016 study, symptoms may start in the shoulder in around 15% of people with ankylosing spondylitis. As the condition progresses, the study concluded that shoulder pain may go on to affect around 35% of people. Other symptoms. Ankylosing spondylitis occurs due to body-wide inflammation, meaning that more general symptoms may develop alongside neck and shoulder pain. This can include lower back and hip pain, abdominal pain, vision changes due to uveitis, lung involvement including a dry cough and shortness of breath, loss of appetite, unexplained weight loss, loose bowel movements, fatigue, psoriasis and other skin conditions or symptoms. What causes ankylosing spondylitis in the neck and shoulder? Ankylosing spondylitis occurs when inflammation leads to stiffness in the joints and ligaments that usually keep the spine flexible. The underlying cause is still unclear and anyone can develop ankylosing spondylitis. However, certain factors increase the likelihood of developing ankylosing spondylitis, including having family members with ankylosing spondylitis, being under the age of 45 years, living with other inflammatory conditions such as psoriasis, Crohn's disease, or ulcerative colitis. Researchers have linked one gene called HLA-B27 to ankylosing spondylitis development. Though not everyone with the gene goes on to get ankylosing spondylitis. In rare cases, people with ankylosing spondylitis may experience atlantoaxial subluxation, which is misalignment of the second and third cervical vertebra. Although this misalignment does not usually cause symptoms, some people may experience neck pain. The reason that ankylosing spondylitis symptoms may start in or progress to the neck or shoulder is also not always clear, as everyone with ankylosing spondylitis has a different experience of the symptoms. What are the treatments for spondylitis in the neck and shoulder? Gentle exercise and working on posture may help relieve ankylosing spondylitis pain. A doctor may also recommend medication, physical therapy, and in rare cases, surgery. Physical therapy. A physical therapist can create an exercise program for an individual with ankylosing spondylitis to help improve joint flexibility, spine mobility, muscle strength. People with shoulder symptoms and stiffness and pain in the spine and hips may also benefit from hydrotherapy, which involves using specific exercises in a warm water pool. Medication. Medications may help relieve pain and discomfort and reduce the inflammation that causes ankylosing spondylitis symptoms in the neck and shoulder. A doctor may recommend the following: pain relief medications. This may include acetaminophen and non-steroidal anti-inflammatory drugs such as ibuprofen. Biologics. Doctors may use biological therapy injections of targeted anti-inflammatory drugs when non-steroidal anti-inflammatory drugs and physical therapy have not helped. Biologics for ankylosing spondylitis may include anti-tumor necrosis factor drugs or interleukin 17 inhibitors. Disease-modifying anti-rheumatic drugs. These drugs can reduce inflammation and prevent joint damage. Short-term steroid treatments. During flare-ups, doctors may recommend these in the following forms: injections for joint and tendon pain. Joint and tendon pain. Occasional oral tablets. Eye drops for eye inflammation. Surgery. Surgery is rarely necessary with ankylosing spondylitis, especially in the neck and shoulders. However, a person may require a knee or hip replacement if ankylosing spondylitis severely affects those parts of the body. When should a person contact a doctor? People with consistent pain, inflammation, and stiffness should contact a doctor. If the doctor suspects ankylosing spondylitis, they may refer an individual to a rheumatologist, a doctor who specializes in treating muscle and joint problems.